talk about the lymph node and lymphatic drainage of the pelvic organs, we first need to understand very basic principles about lymphatic drainage in general. So we'll keep this in the context of the pelvis. So we have three main groups that we can refer to. We can refer to the principal nodes, the intermediate nodes, and their subgroups. So the principal nodes are kind of like the last lymphatic node group, just before that specific lymphatic drainage enters the cisterna chyli, enters the thoracic duct, and then eventually goes into the venous system. So our principal nodes in the context of the pelvis will be the para-aortic nodes, also known as the lateral aortic group. Now, the intermediate nodes that we are concerned with follow the pattern of the blood supply. So we have the common iliac nodes, the external iliac nodes, and the internal iliac nodes. Draining into external iliac nodes will be two groups, the superficial inguinal nodes and the deep inguinal nodes. And all of these intermediate nodes will drain different parts of the pelvic viscera. So let's color code these lymph node groups. Mid-sagittal view of the male pelvis. Here we have the anterior view, and here is the posterior view. Just generally, the organs here, we can see the rectum posteriorly, we can see the urinary bladder with the prostate inferiorly. This structure here is the ductus deferens. And this here will be the testes sitting in the scrotum, and then this here is the penis, so the root and the body, and then here distally we have the glands. And of course on the outside is all skin. So if we start off with the skin, we know that the skin is going to be a really superficial structure, the most superficial structure we have. So the lymphatic drainage of the skin around the male pelvis will be through the superficial inguinal nodes. So here we can just outline it in purple. So including the scrotum as well, because that's just continuations of the skin, and the perianal area. If we work our way through the male reproductive system to see where specific parts drain into and try to make sense of why certain structures will drain into different lymphatic areas or lymphatic nodes, we'll start off with the glans penis. Now, the glans penis is going to drain into the deep inguinal nodes. Now, this is a bit different to the rest of the penis that drain into more superficial inguinal nodes, because embryologically, the glans penis is closely associated with deeper lymphatic structures in the urethra. So here we can color code the glans penis like so, that it drains into the deep inguinal nodes. Now, the rest of the penis, so the shaft and the root of the penis, these will drain into either the superficial inguinal nodes or the internal iliac nodes. And again, this follows the blood supply. But the reason why some of the penis will drain into the superficial inguinal nodes is because it's closely related to epidermal structures like the skin, which we already established drain into the superficial inguinal nodes. So again, we can put a bit of purple around the penis, and we can go to blue to represent that it can also drain into the internal iliac nodes. And this is just following the blood supply. So then if we go to the testes, now we know that the testes, these are going to be gonadal structures. Now we know that the gonads will develop retroperitoneally in the abdomen, and then either they descend down into the pelvis, so this is when we're talking about ovaries, or they descend through the inguinal canal and into the scrotum, so the testes in this case. So if they embryologically originate in the abdomen, their lymphatic drainage will also originate near the abdomen. And what makes the most sense here would be for the testes to drain into the para-aortic nodes directly, which they do. So here we can again color code the testes themselves in that para-aortic node color. Then we have the epididymis and we have the vas deferens or the ductus deferens. Now these will drain into the external iliac nodes, again just following their blood supply, but here we'll have some combination from both the para-aortic nodes and the external iliac nodes. So we have a combination of blue and green here to represent the lymphatic drainage of both. Then we come across the urinary bladder and the prostate. Now, the urinary bladder and the prostate, these will drain into the internal iliac nodes and the external iliac nodes, just depending on what aspect of the bladder we're talking about. Now, the inferior aspect of the bladder will drain into the internal iliac nodes, again, just following the blood supply pattern. Following the blood supply pattern, that is the superior vesicle and the inferior vesical arteries that come from the internal iliac arteries. And then same thing for the prostate. So we have the prostatic arteries over here, okay, which then makes sense that we have the prostate lymph nodes, or the prostate rather, draining into the internal iliac nodes. Then we have the superior aspect of the bladder, or the base of the bladder, which drains into the external iliac nodes. And this is just because of the proximity that it has to the external iliac artery. So this aspect of the urinary bladder is around the pelvic brim, and we know that the pelvic brim is going to be that landmark where the common iliac artery is going to bifurcate into the external and the internal iliac artery, and it just so happens to be just a bit closer to the external iliac artery. Now, of course, when we have this demarcation here, that's saying that the superior aspect of the urinary bladder drains into external and the inferior drains into internal. This is not so neat in, realistically speaking, right? There's always going to be a little bit of overlap between these lymph nodes, or a little bit of variation within these lymph nodes.